Dr. Fausto Viterbo. I'd like to know, why did you choose this field of specialty?
Everything started in my PhD thesis in 1992 when I discovered a new way to connect peripheral nerves. Peripheral nerves, when you have a cut in a peripheral nerves and you have both endings, you can suture, you can connect them again, and the axons will grow to the distal ending and the nerve will be good again. But sometimes you have a lesion in a nerve and you don't have the proximal ending, so you have only the distal ending. And so what we had to do, it was to cut a healthy nerve in the neighborhood and use the proximal ending and connect end to end. I discovered in my PhD thesis that we could suture the distal ending in the lateral aspect of a healthy nerve in the neighborhood. And this donor nerve will allow the axons grow laterally without harming this nerve. And this was a revolution, because any nerve may be used as a donor nerve. And so since then, I don't stop thinking about new possibilities to use donor nerves to treat new disease, new problems. I start using in facial palsy, doing the cross-face with end-to-side neurography. The traditional cross-face, we put nerves connecting the healthy side in the face with the paralyzed side, but cutting nerves in the healthy side and doing end-to-end. So with the end-to-side, I start doing the cross-face and put end-to-side in the healthy side and bring axons to the paralyzed side without harming the healthy side. And then I use this in paraplegics to treat the lack of sensation and that produce pressure ulcers, and this is a big problem in paraplegics. So I used to put nerve grafts in the intercostal above the lesion, the spine lesion, and put in the skin, and these patients didn't get pressure sores again, pressure ulcers again. I use this tool to patients that lost the smell capacity. I put a nerve in the side of the supraorbital nerve and put the nerves in the roof of the nasal mucosa, and the patient regain the capacity of feel of smelling. And this open new techniques from other colleagues to use in the end-to-side to re-innervate the cornea, to re-innervate brachial plexus lesions, and other applications. But then in 2011, we had this idea, and we developed with our group in Botucatu University of Medicine, with Dr. Trindade, his son Trindade Filho, André, and Wagner. We created a team to study this new possibility to use the end-to-side in patients that had prostate cancer. And so we put nerves connecting the femoral nerve in the inguinal area with two nerve grafts end-to-side in the femoral, and the other ending of these nerves we put one inside the corpus cavernosus in the penis and the other nerve in end to side in the dorsalis penile nerve. Bilateral, so 4 nerve grafts. And the result was spectacular. 60% of these patients regained the full capacity of sexual activity with penetration and with a normal life. And the other 40 that doesn't get this full capacity, but present many other signs like nocturnal erections, flaccidity erections, semi-rigid erections, and this make them feel alive again. And they told us, oh, my life changed a lot because I have penile reactions when I see good, beautiful things, and I feel much more comfortable and happy. And so this changed our lives, of the patients and the doctor. This is very stimulating for us.